Good afternoon, everybody. My name is Dr. Kabiru Usman Suru. I'm presenting on Isoniazid preventive therapy implementation among people living with HIV/AIDS enrolled in care at Specialist Hospital Yola, Nigeria. This is the site of where the study was conducted. It was Specialist Hospital, which is one of the ART comprehensive sites that has more than 10,000 clients enrolled into the care and treatment in Adamawa State, Nigeria. The background of the study includes the following. Nigeria ranked 5th among the 22 countries that contributed 80% of the global tuberculosis burden in the world. And the risk of developing TB is between 20 and 37 times greater in people living with HIV/AIDS than those who do not have any HIV infection. And even though the prevalence of the TB is higher, and there is significant evidence that shows that IPT reduces the incidence of TB in the HIV-infected individual, but the utilizations and the level of adherence to it is still low as expected in Nigeria. And that is why this study was conducted in order to assess the level of its implementations among the people living with HIV in Specialist Hospital Yola. And the study is the first study that was conducted in that state or that region with regards to the IPT implementations. The method or the methodology of this study, it was a retrospective cohort study that was conducted to examine the IPT implementations among the people living with HIV. And the HIV-infected individual enrolled into the HIV care and treatments from January to December 2015 were considered for that study retrospectively. And all their informations were extracted from the IPT enrollment register at the facility as well as the client folders. And those informations were cross-checked for correctness, completeness, and compared with the district health information system, which is one of the reporting systems that we are using for the HIV prevention care and treatment in Nigeria. It's a national software that is used to document services provided at the facility level. And the data was also analyzed using the Excel. And the chi-square test used to measure the strength of association between the variables and probably the statistical significance level that was set as less than 0.5 and at 95 confidence interval. These pictures is just to show that how the IPT or the Isoniazid was kitted for the clients in that specialist hospital for the period of that study. And this is all the kitted kits were labeled the level with the names of the clients, their number, and their enrollment date, which will help to monitor those that defaulted during the period. And this is just showing the lead author together with the co-authors as well as the facility staff that was recruited and mentored during the period of that study. So the results of that study, 873 clients were enrolled into the HIV care and treatment from that period and were all screened for TB in that facility. And 89%, that's 777 clients, had no presumptive TB. That means among those that were screened, this number of clients do not have any presumptive TB. And even though we have that number that do not have presumptive TB, but only 273, that's account 35% of those without presumptive TB were initiated on the IPT, and out of those with presumptive TB. And out of those ones that were initiated, 149% clients on ART and completed their IPT. as against the 97% pre-ART then that completed. And this shows that the adherence to IPT among the clients enrolled in the care in that facility among the ART is higher compared to those pre-ART. Though all the clients enrolled into the HIV during the study period were screened for the TB, however, less than half, that's 35% of the clients with presumptive TB, were initiated only on IPT. And even though, as I said, even though all the clients enrolled into the HIV care were 100% screened for TB, but only 27% clients with presumptive TB were initiated on IPT out of the 777 clients. And this was attributed to the stock out of the IPT, as well as the knowledge gap among the healthcare providers and the lack of awareness of the importance of the IPT itself among the people living with HIV. And therefore, adherence to IPT was higher among the clients on ART compared to those pre-ART clients. So, in conclusion, the study shows the IPT utilizations in the prevention of TB among the people living with HIV in that facility was very low. However, consistent availability of Isoniazid tablets, as well as the creation of more awareness among the healthcare providers and patients, will definitely improve the uptake of the IPT among the people living with HIV. And effective and continuous adherence counseling to eligible people living with HIV, particularly the pre-ART clients before commencement of the IPT, will help in reducing the rate of defaulters on the IPT. And it's also recommendations that the government needs to include the IPT as an integral part of TB HIV planning and reporting, monitoring, and evaluation in order to ensure that all the HIV positive clients enrolled into care that do not have any presumptive TB are commenced on the IPT, since we already know that this IPT it helps those patients from the latent phase of TB moving into the active stage of TB. Thank you very much.